Hey everyone, it's Trend Watch Viral here. Today, we're talking about something extremely serious. Urgent announcement. The United States has recorded its first measles death in nearly a decade. A school-aged child in West Texas has passed away amid a growing outbreak that has infected at least 124 people across 9 counties. This is the first U.S. measles fatality since 2015. How could this have happened when there has been a working vaccine against measles since 1971? The unvaccinated child was being treated at Covenant Children's Hospital in Lubbock when they tragically died Tuesday night. Hospital officials confirmed the death, but haven't released the child's age or identity. They did note, however, that the patient was not from Lubbock County. Dr. Amy Thompson, CEO of Covenant Health, emphasized the gravity of the situation, saying, "This is a big deal. We have known that we have measles in our community, and we are now seeing a very serious consequence." The outbreak, which is Texas's largest in nearly 30 years, has primarily affected Gaines County, where 80 cases have been reported. Health officials say the spread is happening within a close-knit, under-vaccinated Mennonite community. Gaines County has one of the highest rates of vaccine exemptions in Texas, with nearly 14% of school-aged children opting out of at least one required vaccine last year. So, what exactly is measles? It's a highly contagious respiratory disease that usually causes rash, fever, red eyes, and cough, but it can lead to severe complications. According to the CDC, up to 3 out of 1,000 children with measles will die from respiratory or neurological complications. The most common fatal complication is pneumonia, which develops in about 1 in 20 children who get measles. Dr. Laura Johnson, Chief Medical Officer at Covenant Health, revealed that some patients have required significant medical intervention. She said, unfortunately, like so many viruses, there aren't any specific treatments for measles. What we're doing is providing supportive care, helping support the patients as they hopefully recover. Health experts keep emphasizing that the MMR vaccine is safe and highly effective at preventing infection and severe cases. The first dose is recommended for children ages 12 to 15 months, with a second dose between ages 4 and 6. Now, let's talk about the federal response. During a cabinet meeting, Health and Human Services Secretary Robert F. Kennedy Jr. addressed the outbreak but misstated several key facts. He claimed 2 people had died when there has been only 1 confirmed death and suggested hospitalizations were mainly for quarantine. Dr. Johnson directly contradicted this, saying, "We don't hospitalize patients for quarantine purposes. Quarantine is absolutely not something that would happen in a healthcare facility. We admit patients who need acute supportive treatment in our hospital." Kennedy, a known vaccine critic, described the outbreak as not unusual, adding, "You have measles outbreaks every year." However, health officials point out that the U.S. had previously eliminated continuous spread of measles back in 2000, with outbreaks in recent years directly tied to declining vaccination rates. Experts warn that the outbreak could last between 2 to 6 months. Dr. 𝐁𝐑𝐄𝐀𝐊𝐈𝐍𝐆, an infectious disease epidemiologist, says, "That's a long time. That's a lot of kids infected. As you have more people infected, these sequelae become more common." Dr. Jeffrey Kahn, Chief of Infectious Diseases at Children's Health in Dallas, emphasized how contagious measles is. If you put 100 people in a room who are not immune to measles, and 1 person enters that room, at least 90% of those people are going to get infected with measles. Health officials in Lubbock have opened free vaccination clinics, which have so far administered about 70 vaccinations since the outbreak began. This number will be higher by the time you are watching this, though. State officials say they're deploying all necessary resources to the affected areas. The reality is that approximately 95% of a population needs to be vaccinated to prevent a measles outbreak. But vaccination rates in the affected West Texas areas range from just 20% to 50%. As this situation continues to develop, Trend Watch Viral will keep you updated on this concerning public health emergency. For now, health officials urge all parents to ensure their children are up to date on their vaccinations. Stay safe and stay informed. Okay, one last thing. For free access to a brain audio breakthrough recording that until recently was kept hidden from the general public by the rich and powerful, and which can help ordinary people like you and me, regardless of our current situation, to be able to learn how to start building wealth quickly, please send an email to trendwatchviral@gmail.com before this recording is taken down.